Okay. Hello, everyone, and thank you for joining us today. My name is Jen Bentley, and I'm the Alumni Engagement Officer for the Faculty of Health. I'd like to begin tonight just by acknowledging that much of the work of the University of Waterloo takes place on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Our main campus is situated on the Haldeman Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work toward reconciliation takes place across our campuses through research, learning, teaching, and community building, and is centralized within our Indigenous Relations Office. If you're looking for more information about for some learning or resources, that's a great website to check out. So I'm excited to welcome everyone to our final alumni office hour of the week, featuring alumnus Meghan O'Neill. Bringing alumni back to connect with our students is a really important priority for both the faculty and for the broader university. Alumni help show students what's possible and give you a sense into their story and how it might be help you see a path for yourself in the future and shed some light on possibilities for you. So we do run these office hours every term. This was the first week of events for the spring term, and then we'll run another series of events in June as well. So look forward to that. But if you do have any requests for careers that you'd like to see or topics you'd like covered in these sessions, I'd love your feedback. So feel free to share that at any time in the chat tonight, or you can always shoot me an email with your ideas. It's jennifer.bentley@uwaterloo.ca. So in order to make the most of this small group session, I'd really like to invite everyone to turn on their cameras and be live and present with Meghan as she is here to share information with you, answer your questions, and engage with you. So it's great to have you on screen if you're somewhere where you're able to. And when we get to Q&A, I encourage everyone to use the reactions to raise your hand, turn your mic on and ask your questions, and make this a more personal and engaging session. So thank you to those of you who are able to turn on your cameras to start. Nice to see some student faces. And what I'd like to do first as well is if everyone could take a moment in the chat to say hi and put the program that you're in and what term you're in for study or school or co-op, sorry, just so we get an idea of who's here, or if you're alumni, a master's student, any of that. So feel free to put that in the chat so we can see who's in the group today. And with that, instead of me reading a bio, I'm going to let Meghan introduce herself and share her story from her time at Waterloo to where she is today.
Thank you, Jen. Like Jen said, my name is Meghan. My pronouns are she, her, and I'm really excited to be here today. So I just wanted to thank everyone for joining. I guess I'll start by saying that I took the health studies program at UW. I actually didn't start my undergrad in health studies, though. I entered in rec and leisure, and after taking a couple courses in the health studies department, realized that those types of courses really spoke to me. I was particularly interested in the prevention of disease and kind of working more upstream. So that really drew me to health. In my second year, I transitioned from rec and leisure to health studies, and I did the co-op program. Once I graduated, which I think was in 2017, I was super keen to do my MPH in Epi, and I took in my fourth year the epidemiology course that was offered with Mark Oramus, and just I really loved kind of how it merged a bit of stats, a bit of like population level thinking, prevention, and was pretty set on applying to the MPH and Epi program straight out of my last year. I submitted applications to a small handful of programs, mostly MPHs, but I also did explore MSCs. And my top choice though was U of T, their Dalla and the School of Public Health. And I didn't get in the first year I applied. It's a pretty competitive program, and I took that year and moved out west. I worked as a research coordinator at the University of British Columbia for a year, and I developed some of my research skills, more applied public health research in physical activity, specifically in public health. So a lot of the interventions that we evaluated in the lab were, for example, using accelerometry data, different physical activity interventions in schools. And I was able to get a couple publications from that work in the lab, and was accepted into the MPH epidemiology program at U of T the following year. So I moved back from BC to Toronto. I did my MPH where I specialized in Epi, but I also did the collaborative specialization in public health policy. So you can kind of think of specializations as like a minor for your master's. And the MPH program has 2 practicum placements. So for my first practicum, I worked at the university in a research lab. So you'll kind of, one common trend you might be seeing is that a lot of my experience is in academia and is in research. And that's how it initially was built, although I do have experience in other sectors as well that I've gained more recently. So through the MPH, there are 2 practicums. The first one I did at a research lab at U of T. As a part of the practicum, you're required to produce some type of like output. So typically in the form of a report or paper. And for my first practicum, I published 2 papers using the Canadian Community Health Survey, which you may be familiar with. It's a population level survey for Canada. And in my second practicum, I actually did it with the same lab. So I stayed with the same lab I did my first practicum with, and I'm still with them today. But my second practicum, I got a bit of a different experience. I used ICS data. So it's formerly called the Institute for Clinical Evaluative Sciences. You might have heard of it. They have a wealth of population-based data linked to healthcare use information. And for my second practicum, I published 2 more papers looking at healthcare use and risk of homicide victimization. So very different area. We collaborated with people at the Public Health Ontario, who were leading researchers in violence, and we leveraged our kind of like population health perspective for that work. And once I graduated from my MPH, I stayed with the lab, and so I've been working as a research officer and epidemiologist under Dr. Laura Rosella. So she runs the Population Health Analytics Lab at U of T. She's an absolute powerhouse researcher. She has a huge research program, and I get to work on several different projects. One of my key areas that has kind of evolved in recent years is evaluation work. So I do a lot of work currently with different community-based organizations in Toronto to evaluate some of their programs. And I'm happy to speak a little bit more about what those look like. But generally, I use a lot of mixed methods approaches in my work. So I'm using R almost every day, R or SAS. And for the qualitative piece, we often do focus groups or interviews for a lot of the work and the projects that I work on. And it's a lot of writing. So a lot of writing up the kind of results from the evaluation, working with different partners, kind of leading meetings. Sometimes we get to do site visits, so we get to get a better sense of what it's like in the program. For example, one of our programs, we're evaluating patients that visit the ED in Toronto with individuals who have lived experience of homelessness, incarceration, and drug use. And this program was formed on the basis that individuals who access care in the ED often receive substandard care experiences. So they often feel a lot of stigma when interacting with the healthcare system. So by pairing them with a peer worker, who's an individual who has that lived experience, the peer helps them kind of navigate the health system. And so one of the evaluations that we're working on is that program. So just understanding how the peer worker changes the care experience, and evaluating different components of the program, how like integrating a peer worker into the clinical care team changes those provider dynamics. And so, yeah, basically seeing a research study from conception, so designing all the data collection tools, submitting the REB or the QI application, and then through to data collection, through to analysis and publication. So that's, I think, in a nutshell, where my path has kind of been. As you know, during the pandemic, the skills of an epidemiologist have been more important than ever. So during the last year, I did work part-time as well for York Region Public Health as a statistical data analyst. And so that's for a government regional health authority. So it's a little bit different than my experience in academia, different kind of working environment. I find in that space, I got to work with a lot of professionals I would have never worked with in academia. So my team consisted of nurses, hygienists, quality improvement specialists, like people just that you wouldn't typically be exposed to in academia, a lot of applied public health professionals. And so I worked with York Region for a year, just doing statistical analysis to support the COVID pandemic. So looking at risk factors for getting COVID, mortality from COVID, and then using that data to kind of inform interventions or policy decisions in the community to mitigate risk. So I think that's kind of in a nutshell. I'll pause there. I feel like I've been talking for a little while, but I'm happy to take any questions you have about like the type of work that I've done or skills that are needed, or if there's anything that kind of jumps out to you to start.
That's great. Thanks for sharing all of that with us, Megan. So I'll invite the students again. Anyone who has a question, you can raise your hand and we can start with some questions. If you're not comfortable coming on, you can always put it in the chat and I can read it out for you. I'm going to go to the questions that were submitted through registration, and maybe I'll find one that we can talk about to start. So there was one question you mentioned a bit about software that you use, and so there was a question about that. That said, do you work with software on a regular basis as an epidemiologist? And if so, what software is a common tool that students should take the time to learn?
Yeah, this is such a great question. So whoever submitted it, thank you. I remember in my undergrad, I had the chance to take some stats courses. I think the prof's name was Jack Robertson. It was a long time ago, so I'm not sure if he's still around, but I learned SAS through those courses, and that served me very well in my MPH because we did use SAS. I will say R is another great software. Once you learn one type of coding language, it is relatively easy to move to one or the other. So in my day-to-day life as an epi, I use SAS and R quite regularly. Another software that is not statistical related, but is, I think, such a key skill in the future of epi is knowing how to use spatial data and knowing how to display spatial data. And one software I'd really encourage you to learn a little bit more about is Arcgis. So that is a mapping software to display spatial information. So for example, the government has quintiles. They report on area-based measures of deprivation, so material deprivation or income, for example. And you can use ArcGIS to visually display the differences in neighborhood kind of level of variables and area-based measures. We know that health is not determined solely by individual risk factors. We know that the environment plays a huge role in shaping health outcomes. And if you have those skills to use ArcGIS, it just puts you like another step kind of ahead of somebody who's not familiar with using geospatial software. So highly recommend looking into that. It's a free software too, and there's lots of online tutorials you can take and YouTube videos to watch to just kind of familiarize yourself with it. I guess if you're looking to do mixed methods work and you kind of also want to have that skill set, I often use In Vivo or Deduce to do some of the qualitative work that we do, and recommend those, looking into those a little bit. I think those are probably the like backbone of the software that I use on a regular basis.
Great, thank you. You all have a long list of programs to learn now.
I don't want to overwhelm you. I only went into my master's knowing SAS, and if you just know a little bit of one statistical program, I think that's super helpful because like I said, they're really translatable.
That's great. Yeah. William, I see you put a question in the chat. Do you want to ask it? Or would you prefer me to read it?
Do you want to read it? You know, kind of shy, you know.
Sure. So William you're going into a Master of Science in epidemiology, right?
Yeah, this is called McGill. It's a research-based master's. So I'm curious about, say I graduate like in 2 years, like do I need a PhD like to work as an epidemiologist? Say I don't have a PhD, like is that like a bad thing? They're like, okay, you have a PhD, do you know what you're talking about? Like, I'm just curious about your thoughts about that. Does it really matter or no?
Yeah, so first I just wanted to say congratulations on your acceptance to McGill, to the MSc program. It's a huge achievement. It's a very competitive program. To answer your question, it depends. So to be an epidemiologist, you don't need a PhD. What you'll see in a lot of the job postings, it depends where you want to work as an epidemiologist, but let's say you want to work for Public Health Ontario, or say you wanted to work as an epidemiologist at McGill in a research lab. A lot of the requirements typically say MSc/MPH or PhD. You might start in a higher pay band if you come in with a PhD. That said, I find if you have about 5 years of experience, that's equivalent to a PhD. It depends what your career goals are in terms of whether you want to do a PhD or not, and whether I personally think it's worth it. But to be an epidemiologist, you don't need a PhD. What I would recommend you do throughout your master's is you develop your skills using different statistical analysis software, using linked population level administrative data, and kind of develop a little bit of a niche in terms of what you are interested in researching. So is it chronic disease prevention? Is it infectious disease? You know, what types of methods are you going to develop your expertise in? And I think that experience working with population-based data, having those software skills will set you up in a good position to get a job as an epi. If you have any other questions kind of as a spin-off from that, please let me know.
I'm good for now, thanks.
Yeah, no problem. I'm currently facing the struggle as to whether to pursue a PhD after doing my MPH and working for a little bit. I think it depends on ultimately like where you want to end up. PhDs are great if you want to be in academia and you want to run your own research lab. I think that will set you up extremely well to do that. There's also, I guess, a certain lifestyle that comes with running your own lab. Your work never really stays at work, and I find a lot of professors I know bring their work home with them. So it depends on what type of work-life balance you want to have for yourself. Not to say that there aren't professors who have a better work-life balance. There certainly are, and I think it's manageable, but there are also job options beyond academia for PhD. Like you could go into consulting. I know a number of PhD students who have gone to work for like Boston Consulting Group or different consulting agencies doing more pharmaceutical and healthcare related, working with clients and stakeholders on different projects. So there's lots of avenues as well. If you did want to do a PhD and work outside of academia.
I have like just one more question, if it's okay.
Mm-hmm.
So say I'm in 2024 right now, and I'm in a job right now, and so say I don't have a PhD, I have a MSc right now. Like, does not having a PhD, like, is it like a barrier to like promotion wise? Like, do you need a PhD to get promoted on a job? Like, would you say that is like a barrier or no?
Is having a PhD a barrier to getting promoted?
So you say not having a PhD. So I'm at MSc right now. Yeah, and it's like there's a promotion coming up, and it's like my colleague has a PhD and I don't have it. So would that be a barrier or no? I'm just curious, you know.
I think it will depend on the organization, but from what I've seen, so let's say like there will be certain jobs, for example, in Public Health Ontario, in the Chronic Disease and Injury Prevention Department, there is a lead scientist. And to have that role, you need to have a PhD. Sometimes in some organizations, they will accept more work experience. Like say you've been at PHO as an epi for so many years, and your work experience is a substitute for that PhD. Some organizations will allow that. I don't think it's a hard and fast rule though. Like I think it depends on the organization as to whether that promotion in the position requires a PhD or not. What I have seen happen is in say like a public health unit, you're working as an epidemiologist, you've been there for 4 years, and you've demonstrated like leadership skills, strong communication, and you've shown your competencies to kind of lead. A lot of the times I see EPIs moving to like a management position. So then they lead a team of EPIs, of analysts, of nurses who kind of work together. So I wouldn't count yourself out of any promotions with just MSc or an MPH in summary.
Okay, thanks.
Mm-hmm.
Great questions. I see that we've got other master's students who are on here, so hopefully that helped many of you who are going the master's route. So another question that was submitted during registration was, what do you see as the most challenging aspect of being an epidemiologist?
Mm-hmm. That's a really great question. Probably pretty loaded. The context of the pandemic created some challenges for EPIs who wanted to advocate for science. And when I think science and public health becomes inherently political during the pandemic. So, there were times when as an EPI, you would advocate for a certain decision that was based on data and didn't see that decision play out in practice because of other external forces. So that was one challenge, I think, that you might face as an epidemiologist in the future, just balancing evidence with all these other kind of environmental macro level factors. And then another challenge, I think, relates to just the evolution of the skills needed and the types of data that are becoming available to work with. Like, we are collecting now more data than we know how to handle or what to do with. And so just trying to stay on top of new developments, like new analytic techniques, new research. And so just like, you're continually learning. In my experience as an epi, the learning doesn't really stop when you graduate from your master's or your undergrad. It's like a continual process. You never really get comfortable with where you're at. There's always something new to learn. And I think for people who want to be lifelong learners, this is a great role for you.
Great, thank you.
Mm-hmm.
Maybe we should turn to the more positive side, and you can tell us what your favorite thing about your job is, and then maybe a little bit more about like your day to day.
So, I mean, I absolutely love where I work. And I think part of that is because I get to work on so many different projects. I'm never just on one research project. And I've recently found a love of evaluation work. That's not something that I was just recently exposed to it, and I never really anticipated that would kind of become my niche. As I said, I did some work in like injury prevention in my master's. I've previously done a lot of work with like chronic disease prevention. I worked with Dave Hammond at Waterloo and Chris Leatherdale. We're doing some of like tobacco research and physical activity research. So I was always in like chronic disease prevention. Never thought that I would be doing more evaluation work, and never thought that I would like it as much as I do. So that's been a really like a big highlight of the last year of my career. It was learning and getting exposed to evaluation work. Nothing excites me more than using evidence to make decisions. Like, I just don't see why it should be done any other way. So with evaluation work, I just love that what I'm doing and what the lab is doing to understand how programs work. So the inputs we drive into them, so that could be people, it could be processes, how they influence outcomes, and how we can tweak those inputs to change outcomes, like, fascinates me. And I probably sound like, hopefully this is like the vibe, but if to some people who like are not as nerdy as me, perhaps would be like, this girl's crazy. But yeah, it's super exciting. We get to work with people across the GTA. So we work with different community-based organizations, and one thread of the work that I do, which is so important, and I think has also fostered my love for evaluation, is that we work with a lot of different equity deserving groups. So like I said, people who have experienced homelessness, who use substances, who have been incarcerated. A lot of these programs work to improve their care experiences. For example, when COVID hit, we know that it disproportionately impacted the people in our society who were most vulnerable. So one project I worked on was, it's called the COVID Recovery Site Project, which evaluated the use of the hotels in Toronto to house individuals who were homeless while they were recovering from COVID. So a lot of the work I do is community-based, has a thread of kind of health equity. I love mixed methods, so I love combining the quantitative data and then telling a more rich, nuanced story with the qualitative narrative. And all of that like really excites me, and it's why I love what I do. And the team that I work with, is the lab that I work with, everyone is just brilliant. So I find like you're never really comfortable with what you know. And I think it's such a great thing to be just surrounded by people who have like similar goals in mind and are always kind of trying to learn and expose themselves to like new situations, new technology. And I think the culture that we foster in our lab really contributes to that like positivity that I have too.
I love your passion for your work and your research. Not my favorite thing. So, but I can totally appreciate, other people's love and just, how important finding something you're passionate about is to being happy and enjoying your work life. And, there's a long period of time that you spend working, and to be that excited and passionate about it is really great. So that's what all of our students have to look forward to, is finding that perfect thing. Another question that was submitted in registration was about why you chose an MPH over an MSc. So maybe you can talk a little bit about that.
Yeah, that's also a question that I went back and forth with when I was in undergrad. It's like, I didn't even actually know an MPH existed for a point in time. I thought it was only an MSc that you could kind of that kind of was your only option. So once I discovered an MPH, I did quite a bit of research trying to understand what the differences were. With an MSc, typically you have like one major focus for your research. So you pick a more specific defined topic, and you spend your 2 years outside of courses really focused on that area. And typically you write up like a large report style document to summarize your findings, and that's what you submit and you defend to a committee. There's also courses that you take in an MSc. So MPHs and MScs are similar in that they have like a course component, but not all MPHs have a research component. So most, or maybe not most, but some MPHs are course-based only. So you have 2 years and you do purely courses. Some have courses and a practicum. And doing the co-op program in my undergrad, I saw the immense value in getting work experience. So I was immediately pretty set on making sure that my MPH had a practicum component. I think I was really on the fence between an MPH and an MSc, but what decided it for me was that I preferred to do an MPH that allowed me to do research during my practicums, but also get that work experience. It's kind of like a hybrid. You get the work experience and a bit of research. What attracted me to an MSc is that a lot of the times you publish your results, and I wanted to contribute academically to publications. But I was able to find with the U of T MPH a program that offered the practicum and that allowed me to publish during my master's. So I think it, for me, kind of just layered all of the things that I was looking for, which was like work experience, experience writing papers and publishing, and the course component. I also liked with an MPH that I could be very specific in what I was studying. So we have health promotion, we have occupational health, you could do an MPH in, you can do epidemiology. We recently launched an Indigenous MPH. So there are just so many avenues to kind of refine what your niche is. And I really appreciated that with the MPH, specifically at Dalla. I know not all MPHs are the same. It's quite a mixed bag, I think, when you look across Ontario. So just I'd advise you to look under the hood what the MPH actually is offering students. So is it just courses? Is it courses and a practicum? Can you publish? Is that important to you? And I think ultimately I I chose the MPH because I wanted that work experience as well. Not that you can't get it with an MSc, like you can totally work while you're doing your MSc, and that's an option as well. So.
Great. Someone had also asked about if you have any thoughts on any extracurriculars that would help in an application to an MPH.
Yeah, I mean, I think like perhaps what I'm about to say goes for any graduate application, but I find it's helpful to demonstrate through your extracurriculars that you're interested in the area that you're applying to study. So for me, I worked or I volunteered with Leave the Pack Behind in my undergrad, and I was doing a lot of tobacco research with Dave Hammond. So when I applied, I had a pretty cohesive narrative in terms of what my research experience suggested I'm interested in, and also what my volunteer experience. So when you're thinking about how you're trying to package yourself and how you're trying to come across to the admissions committee, try to think about the story and the narrative that you want to tell about yourself, and select kind of volunteer experiences that are consistent and strengthen the other spaces of your application that you put effort into. So like I also volunteered in my undergrad for Pathways to Education, which is a volunteer non-for-profit organization that offers tutoring for students who are, I guess, underserved. So students who are low income, have risk factors for not completing high school. And so I think when I applied, hopefully the admissions committee could see, and well, they didn't see it the first time, but they saw it the second time, that you know, I was really interested in health equity overall. So my volunteer experiences were in line with what I was saying I was interested in on my application. I don't think there's like a right or wrong choice for your extracurriculars, but I often like to think and put my energy into, when it comes to volunteering, into things that I'm passionate about. So I think it helps when your volunteer experience aligns with your other interests.
Absolutely. I'm going to shift gears a little bit, and someone had asked about if you had, sorry, let me pull up the question again. How did you build relationships that helped lead you to getting a position at the UBC lab?
Mm-hmm. That's a really good question. I felt in the first couple of years of my undergrad, I was just hoping to kind of blend in, to be honest. Like I never spoke to professors. I wasn't the student that was like at the desk after class. I was like out of the classroom as soon as I could. And I think when I moved programs, I became more interested in what I was studying. I also became a little bit more confident in taking up space. Also, like being okay with going to a professor and like taking their time to ask them questions, or even just ask questions in class. And my advice would be to like leverage the connections with professors that you have as much as possible. So I got more comfortable in my third and fourth year with going to see professors and during their office hours. Some would just like to chat about more like, you know, what my career goals and interests were. And there were a couple professors that I kind of gravitated towards that were really instrumental in my graduate applications, that provided reference letters. And the way I got my placement my job at UBC in that kind of like gap year, if you want to call it, between starting my MPH was through Dave Hammond. I worked with Dave throughout my undergrad just as an RA, just part-time. And I started working for him because I think I just sent him an email one day and was like, I'm interested in smoking cessation research. I volunteer with Leave the Pack Behind. You know, do you have any space for an RA? And so don't be afraid to just email profs. If you're looking for like a research opportunity, if you're looking for a placement and it's not posted on like, you know, where it should be, don't count out sending a personalized email to somebody expressing interest. So that's how I got my undergrad research placement with Dave. And then that lasted for about 2 years, just part-time. And when I didn't get into the master's program, I was interested in just changing things up a little bit, like both developing personally and professionally. And for me personally, that meant moving across Canada by myself and being challenged in those ways. And I feel like I grew a lot in terms of what and learned a lot about what I was capable of. And yeah, I just wouldn't count out like reaching out to professors and leveraging those connections that you have in your 3rd and 4th year. Going to their office hours, just chatting. I had professors support my applications as well as like get me jobs and like facilitate those connections. So Dave was able to kind of recommend me to a researcher at UBC, and I moved over there and worked on a project that is actually based at Waterloo. It's called the UW Compass study that's led by Scott Leatherdale. So that was only in Ontario at the time. And what I did was I moved from Dave's lab at UW over to a lab at UBC. It's called the Population Physical Activity Lab, and launched the BC Compass study. So yeah, I can't overemphasize like just reaching out and seeing what happens. You have absolutely nothing to lose. If there is a professor you want to work with, if there's a lab you're interested in, just send that email. So, and make it personable. I think that helps a lot.
Yeah, I think that's great advice. I think it's often kind of scary to start your networking, whether it's with people in your class or professors or your TAs, or even alumni. But one thing I will say about the alumni and the community within the Faculty of Health is that almost 100% of the time, people want to help you if they have the time. And so, you know, it might be scary, but go for it, and you'll be happy you did. So yeah. Okay, another question. Actually, I want to pause and just make sure that there's no questions from everybody who's on live. But I can keep asking questions that were submitted in advance. Okay, I'll keep going. So somebody asked a question about the difference between your undergrad and then going to grad school. So maybe you can talk a little bit about, you know, what's different when you do your master's compared to like when you're learning in undergrad.
That's an interesting question. I have not thought about that in too much detail, but I will say your master's, the feel of a master's program was less competitive for me. Like in undergrad, I feel like the environment that facilitates being like really large class sizes. I don't know what else feeds into that, to be honest, but I just felt it was much more competitive, like the environment. Everyone was trying to get to the next step of their career. Everyone felt like you had to go right after your undergrad to a master's. You have to figure out your next steps right away. There was no time to pause. Whereas once you get to your master's, unless you're wanting to go to med school after your master's, your grades don't really matter. You could get B pluses in your master's, and I will say a fail in your master's, in mine anyways, was 70. So you could get you could sit on that cutoff your whole master's, and you look no different at the end of the day than somebody else who graduated with A pluses. So I liked that about my master's program, in that everyone, it was a smaller class. I believe there was only 35 students, and it had a better sense of community. People with really like-minded aspirations, and I think that that was the main difference when I reflect back on just the feel of your undergrad versus your master's. It for me was a big improvement, I think.
Would you say that grad studies is more collaborative versus the competitive undergrad?
Yeah, it's definitely more collaborative. Everyone's willing to help. It's not about how fast you get there. Everyone's gonna get there at the end of the day. So yeah, I think honestly it gets better. Once you're in your master's, it's just much more supportive, in my experience anyways. Not that undergrad wasn't supportive, it's just you are one of 150 students. Masters are just typically more intimate class sizes, and you're surrounded by people who are studying the exact same thing as you and got there for similar reasons. So yeah, I just think it was a really great experience anyways, and so I'm excited for all of you who are considering a master's for your next step.
Great. Okay, the next question I'm going to ask is about flexibility and career growth. So is there a lot of flexibility and opportunities for career growth as an epidemiologist?
Yeah, that's a really good question. Because I'm still quite early career, so I've been working as an epidemiologist in the university. So say in academia, in terms of career growth, you move up in pay, but I think for career growth, I guess it depends on what they mean by career growth, because I was kind of interpreting that as pay increase almost. It really depends on where you work as an epidemiologist. Your pay varies so widely. So I would say pay as a new graduate as an epi typically would start at a minimum of $60K. If you wanted to move to a health unit, I would say health units typically pay the most for an epi. That's ranges from about $90,000 to $110,000 a year. So there's quite a large variability in where you work and how that influences your pay. In terms of growth in moving from an epidemiologist, I think you would probably need to do a PhD or do some more education, or even I've seen people do an MBA to complement their PhD, and they go into industry. So I think it depends. Once you're an epidemiologist, you can, in terms of career growth, you can make more money if that's what you're interested in, depending on where you work. So you could change that aspect and see growth in your compensation. But I think to change positions, there isn't a lot of, in my experience anyways, a lot of movement up from an epidemiologist, maybe to a scientist, unless you do a PhD. There is one question I did want to answer. I saw in the list because it really spoke to me.
Yeah, go ahead.
So it reads, how good at statistics should I be? I didn't do as well as I wanted in a statistics course. So what other opportunities would you suggest to build and demonstrate quantitative skills? So I took my first statistics course in undergrad. I think it was like second year. I got a 65. Like that's not stellar in any sense. For the MPH, it's required to have a minimum of 80 in a first statistics course. So I was like really working uphill after that 65. But I really want to emphasize that like one bad mark is not a be all end all. And exactly what the question suggests is that there are other ways you can demonstrate that 65 doesn't define you, that you've since then worked really hard to improve. And so one way I did that was I took a second stats course. I didn't repeat the one I did poorly in. I took a second course that was like the step up from the one prior, and I just put my all into it. Came out with like a mid 80s, so that was enough to demonstrate that at least since then I had improved. And I also put all my effort into developing my SAS skills outside of courses. So in my RA-ship with Dave Hammond, working at UBC, I used SAS, and demonstrating those skills through publications or through like reports. It doesn't have to be a publication necessarily, but just projects or reports where you can say, look, like I had this bad mark, but it's 2 years later and I've now done like better in a more advanced stats course, and I've, published one paper, and I, ran a survival analysis, or I ran a logistic regression, and I worked with large population data. And so that mark doesn't really define my stats skills now. So that's what I would recommend doing if you do have a mark you're not happy with, or you have a mark that doesn't meet the admissions criteria. Just work really hard to demonstrate in other ways that you've improved since then.
Great advice. There's another question on here that's, I think, pretty personal, but it's about, I think, choosing between med school and epidemiology. And they asked if you ever considered med school. And then if yes, why did you change your career path? But if not, how did you decide to become an epidemiologist when it feels like med school is like the louder option?
Mm-hmm.
Any advice on that one?
Yeah, I think I'd be lying if I told you that, throughout my undergrad and throughout my master's, I didn't consider med school. I definitely considered it, and I would never, so I've never written my MCAT, full disclosure, never written my MCAT. I work with a lot of clinicians actually. So I work very closely with two ED physicians in Toronto. And I think, I don't know, before pursuing med school, I wanted to determine whether there was a job for me that could be fulfilling and that I could really enjoy. I think this is a really tough question to answer. I think at some point, everybody kind of thinks, is medicine for me? But and there's a bit of a culture still that if you don't have an MD, like you're out of luck and you're not as respected. Your opinions are not as respected. And I'm not gonna beat around the bush. That culture still exists. In research, it still exists. In some labs, they won't even allow people, without a certain level of accolade to be a co-author. That's not the case where I work. We have undergraduate students co-author papers, lead papers, but I think I never seriously pursued medical school at any point. I never wrote my MCAT. And I think the reason for that is I know I've been able to find a career path that I am happy with and that is fulfilling, and that doesn't require me to go through medical school. So I think that there are other ways you can establish yourself as an expert in some fields. If you want to do a PhD, there are also other options more recently, like a doctor PH. So Dalla Lana has just launched it's an equivalent to a PhD, but it's kind of more like practice-based. So it's called a doctor PH. It's very common in the US to have a doctor PH. But there are other options than medical school. And yeah, I agree that the medical school route is very loud in undergrad. I knew so many people who were pursuing medical school, and I still do. I still know quite a number of people who, instead of going, who weren't successful in their last year of undergrad, did an MSc, did an MPH, and then were successful at getting into medicine. And if that is your passion, like, go for it 100%. But if you are not 100% interested and sure that medicine is what you want to pursue, it's a lot of effort to go through to write the MCAT, to pull together your applications, and to regularly apply. I know many people who applied for 2, 3, 4, 5 cycles, and some have been successful and others are still applying. So I think it's important that people know there are so many options outside of medical school, so many career paths that will be just as fulfilling. And always think of what type of lifestyle you want to have for yourself when you're older, and what type of lifestyle that career will facilitate. That's a really great question. That's a really hard one to answer, though. Yeah. I will say I probably rambled a lot.
But I think you gave some great advice that applies to to everyone in their career search. Like you just said, thinking about what kind of lifestyle you want to have, what you're passionate about. Those things are common regardless of what you're considering doing.
Mm-hmm.
So we are getting close to time. So if there's anyone who has any last question they want to ask, raise your hand quickly. But also, I believe Sienna would like to take a screenshot. Is that right, Sienna?
Yeah, just for the recap for our social medias, and then if anyone is uncomfortable with their face being on the social media, you can just turn off your camera. You don't have to be in the picture if you don't want to be.
Yeah. So we'll take a quick second. Anyone who's willing to turn on their camera can do that for the picture. And if you would prefer not to be, you can turn it off. And then Sienna, if you want to just count us down for your screenshot, we can all smile for you.
Lovely. Okay, let me just. Okay. All right, if everyone's ready, I'll do it in 3, 2, 1. Let me just grab one more, sorry.
No problem.
Something went wrong there. Okay, 3, 2, 1.
How'd we do?
Okay, that's good. That was perfect.
Wonderful. Thank you, everyone. And thank you, Sienna. We look forward to seeing your post.
Yeah, thank you everyone for participating in that as well.
Great. And so on that note, I'd just like to take a moment to thank Megan for joining us, sharing so much great information about her experiences and advice for you students. I hope all of you got something valuable out of tonight's session. So on that note, I'm also going to grab Megan's LinkedIn and I'll put that in the chat for anyone who is interested in connecting with her outside of today's event, because, you know, we talked about networking. So here is the link to her LinkedIn. So you can all grab that if you'd like. And Megan, I think, said she's open to anyone connecting and reaching out if you have further questions.
For sure.
Yeah, and then otherwise, just thank you all for being here. You will get a short survey in your email for attending today. All you have to do is choose your emoji smiley face. So if you can take, 30 seconds to complete that when you get it in your inbox, that would be great. It'll just give us an idea of what people think of these sessions. And then keep an eye out for our events in June. Our June 20th is the date for another health grad, and they are a master's program graduate. So if you're considering our programs, or if you're in our programs and looking for job options for the future, make sure to check out our June events, which will be online soon. So thank you again, Megan. It was so great having you, and I hope everyone has a great evening.
Thanks for having me. Bye, everybody.